Hi, I'm Zach Schamberg, the President and CEO of the Pennsylvania Healthcare Association. On March 11th, 2020, the world as we knew it was changed forever. It was then that the World Health Organization officially declared COVID-19 to be a global pandemic. And throughout the following days, weeks, and months, we saw schools move to online learning, businesses close and shutter their doors, and tens of thousands of hardworking people lose their jobs. It's safe to say it's been a tough time for everyone, but no group has been more adversely impacted than those frontline workers and those residents, our vulnerable senior citizens in long-term care facilities. Long-term care, which includes nursing homes, personal care homes, and assisted living communities, has been at the epicenter of the COVID-19 pandemic since day one. And as we approach the 1-year mark or milestone of the COVID-19 pandemic, we at the Pennsylvania Healthcare Association, or PHCA, are now taking a look back because we think it's important to share the perspectives and the stories from those who experienced this pandemic up close and those who were personally impacted by the virus in long-term care. Today, I am very honored to be joined by the following guests who will share their experiences with us. So we'll look back, but we also think it's important to look forward. With me today is Lori Turberville, who is the daughter of a long-term care resident in the Quality Life Services Sugar Creek Nursing Home. Thank you for joining us, Lori. We also have Noelle Kovaleski, who was and is the administrator of Carbondale Nursing and Rehabilitation Center. And now she oversees another nursing home in Northeast Pennsylvania as well. Thank you, Noelle. And finally, Sharon Eister, the Director of Operations at Wilmac Corporation, which is based in York, Pennsylvania. Sharon oversees multiple facilities and communities for Wilmac throughout Pennsylvania. Sharon, thank you for being here. So I want to kick this off, and I want to begin with you, Lori, because I think it's important to share your perspective. And you and I share something in common, because I too have a loved one in long-term care in Pennsylvania. So I'm really curious to hear about your experience. Talk about this past year for us and what it was like to experience COVID-19 with a loved one in a nursing home.
This past year has been really tough being separated from her. We were offered many ways to communicate with her: phone calls, FaceTime, in-person visits, being 6 feet apart, the hug wall. And unfortunately, due to her condition, she didn't, and window visits. And unfortunately, due to her condition, none of those were successful. We continued to do them, but we really weren't able to communicate with her because she only really responds to human touch at this point. My mom is completely dependent, so there is no way that we could take her home. She requires max assisted 2. And the workers here have been absolutely amazing. Some of them even treat her like she's their mom. I know that they've gone above and beyond and sacrificed and put themselves at risk of being exposed. And I thank them every single day when I come in for all that they do and taking care of her.
Right. Noelle, I want to go to you next. So you were and are an administrator. You were an administrator throughout the past 12 months. And on top of providing care and keeping your residents safe from COVID-19, you acted as that connection between the families on the outside and their loved ones, your residents on the inside. So, I want to bring you in and I want to ask you, what was that like? And what were you able to do in your nursing home, in your facility, to keep your residents feeling like they were still living in that community with activities, events, anything that you could do?
Yeah, it was very difficult. We could obviously never replace, you know, the connections that they had with their families. We resorted to technology a lot. We did a lot of FaceTime posts, you know, so the families can see that their loved ones are still visualized, that they're still happy and healthy, and that they're still kind of living a semi-normal routine, even given the pandemic. We did a lot of FaceTime with the families, Zoom meetings if they had a lot of loved ones that they wanted to talk to all at the same time. The staff were really good about even using their own phones. And if they had like downtime, if they were, you know, sitting with a resident or feeding them, if they wanted to call their families at that time, you know, just to give them a little extra attention, they were really good with that. Our facility is one floor, so we were able to still have the window visits outside. But as Lori stated, it is confusing to some of the residents. Some of them were really good with it. They'd get on their cell phone and the family would be on their cell phone outside and they'd talk and it went really well. Others didn't understand, like, come on in. Like, why are you out there? Why can't you come in? You know, they just didn't understand why they weren't able to be in the building. So, you know, we did have some struggles with that. I think equally as important as keeping the residents in touch with their loved ones and keeping them connected was keeping the facility connected with families too. We had a significant COVID outbreak in our building, and the families were really scared. They didn't know what was occurring inside. They couldn't come inside and see, so they were wholeheartedly trusting us on what we were doing. So my facility, we did twice daily Zoom calls with the families. So every day at 11 and at 5, 7 days a week, holidays included, for 60 straight days. You know, we had the families get on. We would have 60 to 70 family members on a call all together, and we were able to give them the daily updates of the day, go over any policy changes that we had, and let them ask any questions about what was going on in the facility. So I think that was really important, and kind of giving them a little bit of comfort also. They weren't, you know, in the dark with what was going on in the facility.
Thanks, Noelle. And Sharon, let me go to you. So throughout the past 12 months, you have overseen nursing homes as well as personal care homes throughout the state. I want to ask you more generally, what has really stood out to you above all else? And what are the things, you know, the 1, 2, or 3 things or themes that you're going to take away from this pandemic, the things that you learned or saw in the facilities and the communities that Wilmac operates throughout Pennsylvania?
I would say that, and I've been doing a lot of reflecting, obviously. I think that we've all been very emotionally affected over the last year. I would describe it as a year of tumultuous change that never really stopped. We kept waiting for things to get easier. That never really happened. You know, we were faced with not really being prepared as an industry, and not of any fault of our own. I think that most organizations, if not all, did their emergency planning. We were all paying attention to what was happening in China. We were expecting something to happen here. As an organization, I know that we prepared as a group, we talked about what are some of the things that may happen as a result if it happens here, if we get the coronavirus here. And we did those tabletop exercises. We talked about what happens if our staff can't be here. What are we going to do to cover open positions? What if the administrator or the director of nursing is out sick? How do we cover those leadership positions? We had plans for everything, but I think what we didn't realize, and as I look back at my notes and all my documentation, we never knew how long it was going to last, and we didn't know what we didn't know. Unfortunately, and I think the one thing that really sticks with me is the fact that back in March, I recall hearing that there were people who were asymptomatic spreaders, and there was no testing. I remember I kept asking, why can't we do testing? Why can't we find out if anybody here has it? And the answer that I kept getting from anyone was, well, we can't test unless there are symptoms. And when I would say, but we already know that it's spreading via asymptomatic people. That never really changed until around May. And fortunately, that's when people started to realize, once we did, and we were part of a pilot project. My one building was in a pilot project with Department of Health and that hospital association. I had reached out and asked for test kits because we couldn't test, and the governor and the Secretary of Health had indicated that they were going to send test kits to everyone, and I wasn't willing to wait. I got on the phone and I called and I said, send me these test kits. I need to know what I'm dealing with. So that just prompted a real game changer for us. That's when we had the National Guard come in. We had all the testing done. We did fit testing. We were able to rapidly address whatever was happening, and we identified many asymptomatic, both residents and employees. From that point on, we had the outbreak contained within a month, which is incredible. So I think testing, walking away, I think that people should have paid attention to the importance of testing. I think the response was slow. And in looking to the future, we were already preparing for the future as we were going through the outbreaks. We were learning from the fact that we didn't have the supplies we needed. Those supplies, the gowns, the gloves, they did not come to us. So when we started having our outbreaks, we didn't have the supplies that we needed. And we were having discussions on the fly, preparing for, we were already talking about in the fall, we're going to have the flu. And what if we have this, double outbreak between flu and COVID? And we started adding to our emergency plans that we were going to stockpile PPE so that we would not ever have to go through that again. So I think looking back, there are multiple things, Zach, that I could take away and that I could really talk about as far as the past year. But I think the most important thing is, number one, that we recognize where we failed, also recognizing the opportunities, and always being prepared and being able to make decisions as things happen and to do that quickly.
Thanks, Sharon. And I think, Sharon, you laid it out perfectly. And I think it's something that the four of us can agree on. And I know as we talk to members throughout the state, as we're looking back on, what could have been done differently, bringing that provider perspective to the table. And you talked about back in March and April and May, when you were asking for testing or testing asymptomatic residents and staff. Why can't we do this? Why can't we get the PPE we need? Why can't we get the support that we need? To bring that voice, to bring our provider's perspective to the table, I think things could have been done a lot differently in Pennsylvania. It's easy to look back now, but I think one of the things that we can do today is look forward and say, we need that perspective. We need Sharon at the table to share those stories and that experience and those helpful hints that would have been able to guide us in a different direction. Lori, so one of the most important things that we're focused on here now at PHCA and in Harrisburg is a return to safely reopen our long-term care facilities and reinstitute visitation, especially as the vaccine is being allocated and distributed to long-term care. So from your perspective, as a family member, why is reopening and reinstituting visitation, why is that so important?
Over the past year, I've seen my mom deteriorate. She's been getting excellent care and they're doing all they can. But you can tell that she was less responsive. Luckily, I was able to get those compassionate care visits, and they're 2 hours a day, but just seeing the difference in her in that short amount of time, you can tell that they make a difference. And even though I'm here saying mom, you can also encourage other residents in the area when you're here in person. I honestly began to feel like I would never see her up close again, hold her hand or give her a kiss or feed her ever again. So being able to get in and be able to see her respond is everything.
Lori, I think that's exactly right. And again, as a family member, and I share in in some of that pain that you felt and that uncertainty. And I'm glad that you've been able to go in and see your mom. I think you hit the nail on the head. I think that's exactly right. You talked about staff. So Noelle, we're talking about frontline workers, and we all know the term now, healthcare heroes, which I think was originally focused or centered around hospital workers, but came to represent those in nursing homes, personal care, and assisted living, and obviously well-deserved. So the front line was where you went to work every day. You were one of those healthcare heroes. And as Lori just said, we can only imagine the challenges that you faced both in and outside of the nursing home. But through it all, you did remain committed, and your coworkers remained committed to caring for your residents. So can you talk to us about that and tell us why you have been able, or why you are so committed to those that you care for?
Yes, I truly can't picture myself in any other career. I was, a family also in the past. My grandmother was in a nursing home, so I experienced that flip side of it too, where I dropped her off at the nursing home and I thought, oh, did I make the right decision? Are they going to be able to provide the care that she deserves and that she needs? How am I going to follow up on this? How am I going to feel comfortable for this? And on the end that I'm on a normal day, I can provide that comfort to families. I can ensure as an administrator that I'm doing the best to make sure that the residents are well taken care of, and that the families do feel comfortable leaving their family members with us. This is not a job. I don't think anybody in long-term care, this is just our job. You have to be somebody that truly believes in what you do to work in long-term care. It's not just a job to me. I'm as much a part of my facility as it's a part of me. I love my staff. I love my residents, and I truly believe in what I do. And it's very satisfying, like going home knowing that you were able to provide good care to somebody's loved one and make sure they're safe and happy, and you did the best that you could throughout the day. So
Thanks, Noelle. Sharon, again, as an operator, and this goes back to what you talked about earlier, how do you think the pandemic will impact and change long-term care moving forward? How we operate, how you operate, and the changes maybe that need to be made in long-term care?
I think there's probably a couple ways, and ironically, I just had a meeting with this about this yesterday with our organization. Being a healthcare worker out during the entire pandemic, there were a lot of things that we kind of missed. What was going on in the rest of the world, we didn't see. Although I think we recognized that how COVID was affecting how people did things and preventing people from getting together. I think we all had discussions about, this is going to change everything. This is a game changer. And I think now, since we have the vaccine, we're starting to see the numbers come down. I think that we realize more than ever, things aren't going to go back the way that they used to be. So things that we took for granted, for example, I pulled out our marketing plans from last year, and we could not do any of that this year. It was ironic to think, wow, this was a completely different world. The marketing plans included all of these. We're going to do these big community events. We're going to have families, referral sources come in, or we were constantly going out, participating in PR events within our communities, our local communities. All of those things no longer happen. They were all canceled, and I'm not sure when that will come back. I do think that it will. Who knows when that's going to happen? So in the meantime, we still have to run our businesses. We still have to care for our residents. We still have to provide the things that we need to do. And how do we do that differently? And that's really something that our business model is really looking at, because we have to find a different way to reach people. We have to find a different way to make connections. So those are all things that we're talking about now. And I don't just mean in marketing. I would say from healthcare itself, I think we learned that our models, our building models, the physical plant was not conducive. I think someone likened it to, what would you expect of a virus like this? Would you not expect it to spread if you're in a college dorm-like living where people are living so close together? And it's not only that they're living close together, but in our business, we touch people constantly. The care that we provide requires us to be very close, body to body. And there's that cannot change for us. However, I think that it will forever be ingrained in our minds, and probably going forward in our practice, I think that we have probably all become a lot stronger in the area of infection control. I don't recall a time, and I've been doing this over 30 years, I don't ever recall a time when we wore masks, eye protection, gowns, even during flu season. I mean, we wore masks if there was an outbreak, but I really do think, and I kept saying with the flu season this year, we're not even going to see the flu because we've never been this safe before. And that's really what happened. So I think that there are a couple things that have changed, and I think those are probably the key ones from my perspective.
Thanks, Sharon. And so I said we would look forward, and Sharon, I think you started that conversation. At the end of the day, we here at PHCA, we're an advocacy organization. And for the past 12 months, because we haven't been able to bring anyone from long-term care to the Capitol, we've truly served as the conduit between the long-term care providers, the workers, the residents, family members, and the members of the legislature, as well as the governor, the Department of Health, and the Department of Human Services. And we think it's important to get those messages from you to members of the legislature, to the Wolf administration, about what you think is important for them to know, what you've learned and what they need to know as we emerge from the COVID-19 pandemic. So, Lori, let me start with you. What message would you want to send elected officials on behalf of your mom and your family?
Just how important it is to be able to see them in person. You really can't imagine. I think that the ones that are alert and lonely. The ones that are confused or scared and alone. I just think that it impacts the patients, the staff, the families, and not in a good way. So if there's any way they would consider reopening for the sake of everybody involved, I think that that would be a very good thing. I did want to mention that I have a sibling that's out of state. She's in Pensacola, Florida, and due to mom's limitations, she has not been able to communicate with mom for a year. And she has the resources to get here. She also has a job where she has all summer off, so she had all the time in the world to come, but she couldn't get in. And I know that that is extremely hard on her when there's nothing stopping her other than the regulations. Since I've been coming in, I do call and let her talk to mom, but again, she doesn't really understand the phone, so there's not much that my sister can hear, but she's appreciative of any time that she does respond. So it just has a domino effect of affecting many different people in many different ways.
Thanks, Lori. Noelle, I'll ask the same question to you. And, as we have the legislature back here in session in Harrisburg throughout the next few weeks, we're coming up to another state budget, and there's going to be potentially some more stimulus funding that comes to Pennsylvania this spring. What is your message to elected officials as you think about the past 12 months and then looking forward to nursing homes and to long-term care?
I think funding is more important now than it has ever been in the past. It's no longer just a wish for us to get increased funding. It's our survival at this point. I'm scared if we don't. It's getting more and more difficult to perform our tasks the way that we should. Everything has an increased cost. Staffing is always an extreme challenge for every facility. We can't compete with hospitals. You know, the hospitals can offer huge bonuses. They can offer, you know, double the salary that we can offer them. They can offer, you know, if they pick up an extra shift, $600 for an extra shift that they pick up. We don't have that funding that the hospitals have, and it's becoming harder and harder to compete. It's becoming harder and harder to get applicants to care for the residents. You know, we are a very creative industry. We would not have been able to survive this far if we weren't so creative, but our creativity, I think, is running out. Everything costs so much more. The residents that we are getting are more acutely ill. We have to provide PPE. The supplies costs are increasing. The food costs are increasing. Every single cost has increased across the board. And we don't more funding. I fear that there's going to be a lot of nursing homes that don't survive.
Thanks, Noelle. And Sharon, I'm going to let you have the last word. If your legislators were sitting here, the governor was sitting here, Secretary of Health, Secretary of Human Services, what would you tell them? What do you think you need most?
Well, I think number one, they need to start considering long-term care when they're making public health decisions. I think that was very evident that didn't happen very early on in the pandemic. I think CMS did a great job, allowed us to have some freedoms from the regulations where we could operate and do it quickly. I think that the state tends to have a slower response. For example, we've had the vaccine and there's no move yet to get these residents reconnected with their families. And it's very frustrating because I know that the families are frustrated. I know the residents are frustrated. We all want that connection to happen. And I would echo what Noelle said. I think by now, the fact that even though we have the vaccine, there's new variants out there, there's still so much that's not known a year later. At what point, as I mentioned earlier, when are we going to be able to loosen restrictions? The fact that we need to continue to have these restrictions in place means that the expenses continue, expenses that we have incurred costs that we could have never imagined related to the pandemic. That is going to continue at the same time as occupancy levels being down phenomenally. And, you know, I think that they need to recognize there is a need for funding. I do want to add, because this is something very near and dear to my heart, I think it's time to stop blaming the long-term care providers for what happened with the residents in the nursing homes, in the personal care facilities. They literally have no idea. And I think someone said it earlier, you know, unless you've been there, unless you've seen what happened, unless you've seen staff crying, the exhaustion, you have no idea the efforts that were made by everyone involved on the front lines. And there is a need for legal immunity from frivolous lawsuits, and that has evaded us. And I think it's shameful that we're not included in that, because we're just an easy target, and it just makes no sense to me. I just think it's a waste. It's a waste of time. It's a waste of resources. And I think that definitely needs to change along with the funding.
Thanks, Sharon. We couldn't agree more, and very well said. So Lori, Noelle, Sharon, again, I really want to thank each of you for joining us and for sharing your experience with long-term care in the midst of the COVID-19 pandemic. Again, it's our hope that in looking back at the past 12 months, we can learn, and most importantly, we can be prepared for what's next. I'm Zach Schamberg, and on behalf of the Pennsylvania Healthcare Association, I want to thank you for watching.